And we're back. I'm your host, BKP. We apologize for the stream difficulty, but we are back and everything should be running fine right now. I'm now joined by Dr. Tidman. This segment is brought to you by the Georgia Cancer Specialist. And Dr. Tidman, thank you for being here this morning. And, I want to ask you straight out of the box. I think we talked a little bit during the break about health insurance. Talk a little bit about that. Where do we stand?
Well, this is the time of year a lot of patients ask me about what to do with their health insurance, and the Not So Affordable Care Act has really put a major hammerlock on hospitals and physicians and patients, and it's a hard choice they have to make. So one of the things I sort of back up and ask patients to look at is what are they getting out of their health insurance, and how to best strategize that. It's a subtlety because we're pushed to all have health insurance, and we're given this notion that there's all this free stuff. Well, there's nothing free in life, as our grandparents told us, and it's a difficult decision.
Well, Dr. Tidman, let me ask you, you said this when you said Not So Affordable Care Act. This past week, open enrollment started. This past week, we heard states that are now down to one option in many states. Some areas, people have found out their health care is going to exceed cost 100%. What do you see on a day-to-day with your patients?
I mean, I see one nightmare after another. I mean, you can go through all levels of it. Some folks with ObamaCare, like a patient who injured their thumb at work. The employer did not have insurance to cover the injury. He took their ObamaCare to an orthopedist. He did not take their insurance, and he had to run down several different layers of orthopedic care into the basement of coverage just to get care for his thumb. And this is a young man working, paying his premiums. So it turned out that his insurance was nearly worthless. Take my employees. Year after year, their healthcare costs keep going up. My healthcare costs keep going up. And this year they went up another 25%, and at the same time their deductibles went up another $1,000. So we're going from $5,000 to $6,000 deductibles with co-pays going up. So they're paying more for their insurance. They're getting less out of it. Seniors, Medicare, all these advantage plans, all these secondary insurances. After you're 65 and you have Medicare, your costs are protected. Medicare locks in and fixes prices. So you don't have to worry about negotiating price anymore. But at the same time, you have these, what I call predatory insurance companies, coming in and selling you secondary policies that you may not even need. If you're a Medicare patient and you're on simple drugs, 1 or 2 drugs, and they're generics, what is that secondary policy getting for you? Almost nothing. Now, if you're very ill on multiple medications, some of them very expensive, certainly a secondary policy is beneficial because they will have negotiated prices that can help you. But otherwise, you're getting a secondary policy for drugs that are otherwise cheap, and they are determining which drugs you can and cannot have. So they become more of a hindrance, and you're paying for it.
Well, let me ask you this. I'm listening to you, and it sounds like a mess.
It's a mess.
I mean, it just sounds. And what about from your side? I mean, as a physician, the doctor, when you come to see a doctor, you want to concern yourself with the health of the patient. How much time are the doctors? I want to say doctors are concerned about the health of their patient. When a patient walks in, a doctor is generally concerned about the health of their patient. But the system is forcing doctors to have to look at every available insurance option, or what can you do, what can't you do? I mean, is it just made a mess?
No, it's a disaster. It's a rolling disaster. There's a recent study that shows just in my line in primary care alone over the last 8 years, there's now a net addition of 1 person in my office just to deal with insurance. It's expensive to employ people. And that's not doing healthcare. That's just dealing with insurance companies. So the burden, there's more and more of a bureaucratic burden by the healthcare insurance industry where they're justifying their existence, but not a net increase in healthcare being delivered. This thing is, as I said, a rolling disaster. It has to be taken out or changed or completely overhauled. It cannot continue like it is. More and more primary care physicians, senior specialists, other physicians are just throwing up their hands and walking away. And that's just cannot continue.
Well, I have been in, I have the same doctor for 16 years, and I go to the doctor and know everybody in there, and I know the office, and I walk in and I look through the little window and I know the ladies or whoever's in there working. And recently I went there, and there was a lady in I could see in there that was sitting at a computer. I did not know. I never seen this person. This person didn't look as though she was trying to get ready to take somebody's blood pressure. She didn't look as though she was getting ready to draw blood or put you on the scales, see what your weight was. None of that was on a computer. So I went in and I was talking to the doctor, and I said, hey, out front you got somebody new. It looks like a new position, because I look at those things. He said, it's a nightmare. That person, this is a small office, that person is there just to try to comply. That's the word. Try to get everything in compliance, submit everything. That's everywhere, isn't it?
Well, it's everywhere, and it's pervasive through all sorts of things. Here's a great example. I was walking by my nurse one day. She was on the phone doing a pre-search. And there were a lot of quiet pieces where I was just kind of standing behind her listening to her. She didn't know I was there. And I would hear her give her these really 1 or 2 sentence answers. And then I finally said, Renee, who are you talking to? And she said, United. And I'm like, what are they saying? She goes, it's not a they. And I'm like, what is it? She goes, it's a computer. I'm trying to get this patient's medicine pre-certified. And I said, well, just hang up right there.
Wait a minute. Whoa. I'm sorry to stop here. You're telling me you're trying to get a patient's medication approved, because you got to come back and see if the insurance will approve something. You may prescribe something. They got to go see if the insurance will pay for it, approve it. So she's on the phone. I didn't mean to interrupt you, but I want to absorb this. She's on the phone trying to get a patient.
She's trying to get the medicine approved.
But she is speaking in sentences to a computer.
Right. So
okay, I didn't mean to interrupt you. You just.
Well, I mean, you see how alarmed I was. I'm
alarmed too.
These insurance bastards have a machine wasting my human caregiver's time. The goal is not to get the patient the medicine. The goal is to wear down the hospital physician and nurses so they don't ask. That's all it is. And I said, we are not doing this. We're not going to deal with an insurance company if we can't speak to their human. If my humans can't talk to their humans, this is not happening. I am not letting them put a machine in there and put their hand in our face and act like they care, because that was nothing but a how can we act like we care? How can we act like we're going to let you get the patient the medicines they need while making it as pain for you as possible? It was just obscene.
I'm alarmed by that, because what I hope we're doing this morning here, and Cole, I want to make sure this segment gets cut immediately and gets up, because this is great information out there. But what we hear from the media is healthcare. We hear rising premiums, which is true. Okay, we hear that, but we don't hear enough about this is costing the American people in enormous ways that is unforeseen. Your office, having somebody sit on the phone. I have left, a friend of mine's a physician down in LJ, I have left their office, seen somebody on the phone, ran across the street, went back over to say something else to my friend, and the person was they were still on the phone with the same person. 5-10 minutes. And that's not uncommon.
And that's nothing to do with healthcare.
Nothing to do with healthcare.
So here's the other. Get this little nuance. The insurance companies are all telling how they're pulling out of Obamacare or the Affordable Care Act. It's not, they're losing money, they say. And they're saying that, okay? What are the profits in the insurance companies this year? Through the roof, okay? What are the premiums that they're charging to small employers like myself? Higher. Here's the other piece. What are the reimbursements to physicians like myself? Lower. So they turn around and they tell you that they're losing money, that healthcare costs are going up, while they're paying doctors less and increasing the burden in the doctor's office. Now that's a big lie. And no one's calling them on it.
Yeah, I was waiting for the equal. This plus this plus this plus this equals a big lie. Why are they pulling out of the states? Why are they giving the impression that they're struggling under this when actually if you look at their profits, they're up. Okay, why are they giving this impression to the people out here?
Well, it's the same game that supposedly the Affordable Care Act fixed. Insurance companies don't want to take care of sick people. They don't want to take care of the folks that are high cost, high dollar, have a lot of stuff going on. Their game is to avoid those people, right? Now, with the quote Affordable Care Act, they thought they were going to get premiums from a bunch of healthy young people. Well, healthy young people are saying, I'm not doing that. You know, I got other things I want to spend my money on. So all of this, quote, windfall of money they thought they were going to get from all these young people that they were going to start insuring is not showing up, and they're getting sick people who didn't heretofore have health care. So they're not getting what they wanted, they're getting what they didn't want, and the balance is not there. I mean, I'm a business person. I believe in capitalism. I believe in the profit margin. But I don't believe in game playing and finger pointing and crony capitalism. And that's all that we've got going on here.
Well, I think and I'll share with you, I don't think we're upset that a business is working, playing by the rules and making money. I'm not bothered by that in the least. I'm with you 100% there. I think what is most upsetting is we knew these things and they pushed it on us anyway. I remember, seems like it was just yesterday, being 22 and somebody telling me I needed insurance. Okay. I remember bumping into a gentleman one day, about 24 years old, and he said, "You need life insurance." Yeah, really? Okay, that's what I need to do. I need to give you $10. So we knew statistically, we knew the mood of, 20 to 30 years old has not changed. It may be different technology, colleges, there may be major differences in 20 to 30-year-olds from 50 years ago to now, but the one thing that's not different is their feeling on their health of, I don't need that yet. That's not changed.
Right.
Would you agree with that?
I totally agree.
So we knew ahead of time that this generation wasn't going to say, oh, I need to run and get a healthcare policy. We knew that.
Yeah.
So lack of signing up, well, the only thing left is to force them to sign up.
Yeah.
What is your concern on the outcome? Let me close with that. What is your concern on the outcome? I mean, what do you think needs to be done? We hear all the disaster, but what needs to be done to get us to provide the greatest health care in the world, which we do, and get us to have a balance of good insurance premiums that are fair and balanced. Everybody's making a living and going to the doctor.
So it's, in a nutshell, very simple, and it's very similar to what Dr. Ben Carson, whom I'm a very strong advocate of Ben Carson, what he was proposing. We need to go back to insurance being what insurance is. You don't buy car insurance to replace your car battery or your car tires. You don't buy house insurance to fix your screen door. Insurance should be for catastrophic events. So we should be buying health insurance to take care of us if we get cancer or if we've got to have our heart replaced or some other terrible thing. So that's where insurance should be moved. And then we should put programs in place that encourage people to get their checkups done and give them resources or savings or portable accounts that they can move across state line and move across businesses that help them manage their day-to-day healthcare expenses. But all of that should be encouraged where the individual now is making the economic decision, because cost will come down when those eyeballs are on the ball. Costs are never going to come down when insurance companies who make money, the more money is spent. They're making it on the margin. You will never see cost come down with third-party payers, quote, controlling cost. The cost will come down when the public, when the patients ask the question and the doctor sincerely answers, do I need that? Is there a less affordable way to do that? Is this what's appropriate? That's how you start bringing costs down. And that's what Ben Carson has advocated, putting systems like that in place. That takes a top-down, strong leader approach, because it's an overhaul of what we've been doing. We right now have a monopoly or oligopoly of insurance companies in bed with the government who are running one big shell game on the public.
Well, this is an example. I've enjoyed the information this morning, Dr. Tidman, and this is an example of what I was talking about of, we didn't really talk healthcare this morning, as far as different things that people may be suffering from or concerned about in their health. We talked about healthcare, insurance, and that is what's monopolizing in a lot of ways these offices. And I know for one, you and physicians want to focus on your patients.
Yeah.
And this has to stop, because it is generally taking away from actually a lot of physicians being able to put the time and focus on their patients, and that's where it needs to be. Yeah. And these struggles of the I don't know, it's going to take me all day, all weekend to get over that you were getting an approval for medication with a computer. That one's good. That was going to take me. that obviously upset you, Dr. Tidman. I appreciate you coming by. Is there anything final that you thought about today that you wanted to make sure we got out and said? We're 4 days before an election. I'm not saying you have to say anything, but I want everybody to get the chance to say something if they would like.
Well, I'm always notorious for trying to find something funny every day, and this is kind of a medical analogy, but it was pointed out just yesterday to me that Bill and Hillary have something in common besides their last name. They have trouble with wieners.
We're going to go to break. I'm your host, BKP. Thank you, Dr. Tidman. Good morning from beautiful downtown Blue Ridge. We're going to have an update on the Cohutta wildfires as soon as we return. Cole, take us to break.